Here are the 4 dangers of stopping a statin cholesterol drug. Number 1, your doctor might get mad at you. And why would he or she get mad at you? Well, because they think that heart disease prevention begins and ends at a statin drug. They've drank the Kool-Aid, the big pharma Kool-Aid, that tells them that taking statin drugs dramatically reduces risk for heart attack. That's not true. They do not dramatically reduce risk for heart attack. They reduce heart attack risk, best case scenario, in high-risk people a tiny bit. The reason for this is Big Pharma likes to play statistical games with the doctors and with the public. So if we had a drug, say, that reduced heart attacks from 2 per 100 people to 1 per 100 people over 5 years, a reduction of 2 to 1 is reported as a 50% reduction in heart attack. Well, of course, it's not a 50%, it's a 1% reduction in heart attack, right? That's the power of statins. They hardly do anything at all. But your doctor thinks that they're magical cures for heart disease, which is absurd. They hardly have any effect at all. So the risk to you is that your doctor doesn't understand this and he gets mad at you, thinking that either that you're at risk now for a heart attack or he's now left looking ignorant because he doesn't have any other tools to reduce heart attack risk. A low-fat diet doesn't work. Everything in moderation doesn't work. All the conventional notions of heart disease prevention don't work. So you risk getting your doctor mad. That's a danger of stopping a statin drug. Number 2, you risk feeling better. Because when you stop a statin drug, you regain flexibility and feeling good because statin drugs impair muscle. That's why people typically say things like, I have a hard time getting out of my car. I'm only 45 years old, and it's hard to get out of my car because statins cause muscle weakness and pain. The drug industry and the apologists for the drug industry, known as my colleagues, say things like, oh no, less than 1% of people taking statin drugs have problems with their muscles. That's not true. The majority have problems. What they're referring to is something called rhabdomyolysis, which means flagrant muscle damage that can cause kidney failure. That does happen about less than 1%. I'm not talking about that. I'm talking about the very common muscle weakness and fatigue. That occurs in the majority of people. The higher the dose, the longer you take it, the more likely it is you are to get that kind of aging effect where you feel old and weak. So the danger you face in stopping a statin drug is you might feel better again. Another danger of stopping a statin drug, your blood sugar might go down and you'll be protected from diabetes because statin drugs increase potential for diabetes somewhere between 30 and 55%. Huge increase in potential for diabetes. So going off a statin, you're at risk for being healthy. Lastly, if you stop a statin drug, another danger is that you might realize that there's a whole list of other causes for heart disease, real causes for heart disease, that you can address to dramatically reduce or even eliminate cardiovascular risk, such as small LDL particles that are triggered by consumption of grains and sugars, or what are called postprandial, after-meal lipoprotein abnormalities, high triglycerides, and thereby VLDL, very low-density lipoproteins that cause heart disease, lack of vitamin D, big factor in causing heart disease, lack of omega-3 fatty acids, dysbiosis and SIBO, changes in bowel flora, and there's a whole long list of things that you can tackle that truly address cardiovascular risk, not this silly, awful class of drugs called statin drugs that your doctor thinks are the saviors of heart disease. They're not. So those are the dangers. In other words, there is no danger. You can do a far better job in reducing or eliminating cardiovascular risk without statin drugs. And in fact, the health you achieve, whether by weight or by your lipoprotein patterns or metabolic markers like C-reactive protein, you'll see that the benefits you achieve following these kinds of ideas are far superior compared to the silly results you obtain with a statin drug. Now, that's a lot covered. You'll find more about this in my various videos, so please subscribe to my YouTube channel or see my Wheat Belly blog, my Undoctored blog, where I dive deeply into such conversations as what is small LDL particles, why vitamin D is important, how to use fish oil, how to cultivate bowel flora, how to identify SIBO, all these things, all the wonderful, many things you can do to truly address cardiovascular risk, not these silly statin drugs.